Well, we're up at Nobles Hospital, and this is they call it a V-Day. I think this sounds vaccination day. But again, many people are asking the delay in the rollout. First of all, let's deal with that. You're going to say it was safe, there was no rush, but there's been concern, hasn't there?
Well, it's important as a medical procedure we get it right, Paul. We have to remember the timeline. So yes, we did have the tray of vaccines, but we didn't have the Crown indemnity in place. We received that letter from the UK government on the 17th of December. There were certain legal queries that had to go back around that, which I believe were answered off the top of my head. I think it was late on the 18th of December. So by then you're moving into Christmas week. And one of the things we've got to remember with this first vaccine, the Pfizer, is the trays have to be kept at -70. You have to defrost an entire tray of 975. You can't split the trays. Once you've done that, you've got 5 days to basically deliver the vaccine. So on safety points of view, we wanted to make sure it was right, where we had a full week in order to do it, and this is the first full week.
We obviously look at Jersey and Guernsey, and you said they weren't doing it, but they were. Well, Guernsey you didn't think was, but they were, and Jersey reckons it's going to have, 80%?
Well, in relation to Guernsey, at the point I said that, we went back and checked the time, and they actually started 3 minutes before I actually said that. Okay. So they literally had started that afternoon while we were stood on the podium. Right. But in relation to Jersey, obviously they're in a very, very different situation. They took the decision to go ahead before the Crown indemnity was in place. Guernsey took the decision to start on that Thursday when they still only had a letter of comfort rather than the wording of the Crown indemnity. We decided from an Isle of Man point of view, we wanted to do it belt and braces, make sure the protocols were right and in place, and the Crown indemnity, because at the end of the day, this is a medical procedure.
Right, let's run some pictures about what's been happening here. This is the frontline health workers. You're starting with them, not in the old people's homes and that sort of thing. Why?
So obviously with Pfizer there's a logistical issue. You've got about transporting the vaccine. The vaccine can only be transported once. It can't be shaken. You've seen yourselves this morning in the press the effort that goes into reconstituting the vials and actually then the delivery of it. So we have started with healthcare workers. Care homes are in this phase and will be done as part of this phase as the rollout goes on in the next couple of weeks. Can I say a huge thank you to Sandy, who was our first vaccine volunteer.
Trial by media there, wasn't it?
It's not easy for someone who's not used to being in front of the media to sit there, answer questions. It's all a bit daunting, so I'd really like to say a big thank you to her for volunteering to do it in front of you guys.
Now this day is a big day for another reason. In the UK, the second vaccine is now being rolled out. And this is the question that everyone's asking, of course, exactly where are we on that timescale? You're going to say we're on the list. I know you're going to say all that, but really...
I can give a lot more information than that, Paul. Do give me some credit.
I just know that
the first tray of Oxford vaccine has become available for us to order. We ordered it as soon as it became available, which was yesterday, but we don't have a delivery date for it yet.
So why only yesterday to order when the UK, they've already got it in place? And
we've got to forget we're piggybacking off the UK orders, so we receive our orders based on per head of population. So the UK will receive their orders. They will then immediately roll out because they physically got it in their hands. We have to go through an ordering system, so it becomes live on the system, a tray. We order it, and then obviously logistically they've got to transport it to us.
When is it coming?
So we don't have a delivery date yet, but the order is in place.
An idea then? I mean,
so normally,
weeks or months?
Most orders are delivered within a week.
So then you have the dilemma of these two different vaccines to deal with. Will you take whatever is available at each time? Because obviously the logistics are quite different, aren't they?
Yeah, I mean it will be what's available each time. I've got to stress again, people don't get the choice as to which vaccine they actually end up with. Obviously in some settings, the Oxford vaccine lends itself more easily to be delivered because it's much more transportable than the Pfizer one. It doesn't have to be stored at -70, it's stored at fridge temperature. So for things like care home settings and other settings, it's actually much more deliverable.
But I mean, at the end of the day, you want to make sure that it's done correctly, but you can't mix and match, can you, as well? So the second one has to be the same as the first one?
At the moment, the advice is you don't mix and match. Right. Certainly our intention is to deliver the second dose of the same vaccine.
Will you be putting back, like in the UK, that second booster, or will you be keeping to that 3-week sort of rule?
It's being looked at by Public Health. At the moment, we are sticking with the 21 days. Yeah. It may turn out there'll be different advice between vaccines. So, for instance, there is some low-level scientific evidence with the Oxford one that the longer you leave it, the better the response. With the Pfizer one, Pfizer's come out themselves and said the only trials they've done is around the doses being 21 days apart. So they themselves at the moment aren't recommending that you go further out out than that.
But we could move
it's being assessed by public health, and we will act on the medical and scientific advice.
You do that if you're waiting for more supplies and you want to get more people with the first jab. Is that what would be the only reason?
No, it would be based on medical decision. We're not in the same situation as the UK, where they are in the midst of a major pandemic and they need to vaccinate as many people as quickly as possible. What we will do is we will go with the science and the medical advice around when it is most appropriate and when it's most effective to deliver the second dose.
Update on timescales. Now you've got 2 vaccines in place, which is more than we had originally when we talked about this. Give us some ideas and hope maybe for people out there when they're likely to be seen. Obviously it's tiered, we know that.
So the timescales don't change because the timescales are based on delivery schedules. The UK themselves have their delivery schedules of vaccine between now and September. So unless something changes with the UK's delivery schedules, we will receive our proportion based over the 9 months, exactly the same as the UK will.
But that could get better, or it could get worse. I mean,
it's impossible to say. You're in the hands of the manufacturers of the vaccine, and it depends how many doses the UK received. So, for instance, we know that the first batch of vaccine, when it came into the UK of Pfizer, they were expecting 800,000. They didn't get anywhere near that number. So that obviously impacted on what we received because we receive a per head allocation.
Okay, I want to go back to what's been happening on the Isle of Man and this outbreak that was caught, and we had only 2 questions to talk about the other day. Are you still confident that you handled that correctly? Not at 10 o'clock in the morning, and I asked that question and I just want to do it one more time. 10 o'clock in the morning, you could have gone live just to say there's been an outbreak, and people then could have spent the rest of the day deciding if they were or not going to go out and do things, but you didn't. You did it at 10 to midnight, whatever it was.
Yeah, because we didn't have the full facts of the case. We could have gone out at 10 o'clock, but we didn't have any contact tracing done. We didn't have the information. We did, because we didn't know where the people had been as well. So you could talk about people making decisions, but how can someone make an informed decision without any of the facts? So we would have been stood at a podium potentially if we'd done any form of press release or briefing saying we've had this incident where someone has tested positive past the 14 days, they've been out in the community, but at this point in time we don't know where they've been, we don't know who they've been in contact with, we don't have any contact tracing to know how many high-risk contacts there are, and it would have actually caused
panic. People could make their own informed decision on their own, not informed, but they could make their own decision on what we might want to do later that day. I mean, you can see how other people are playing this in their heads, and I've had lots of people say, I think that question was valid.
What we've got to say is if everything had been related to that person the day before New Year's Eve, that would have been actually a very interesting point. But the fact is, so for instance, the venue they were in, that was Boxing Day. Yeah. The case was identified 5 days later.
But then they go and close down, don't they, for a few days?
But that was not on public health advice.
No,
I do need to
point out. But they were taking responsibility.
But the point is, there's been 5 days lapsed by then. So if it had been a case where we'd identified a positive case and they'd actually been out that night, then that might be slightly different. But we have to nuance the response according to the case, and the fact is those venues that they had visited had been days before they actually tested positive.
But staff that are working then would be the same staff that would have been in there on that particular night, and they're serving more drinks. And as I think one of the journalists said, it's gone all right, but it could have gone the other way, couldn't it? You're aware it could have gone the other way.
Well, we would have probably identified something off it earlier if it had gone the other way, because one of the things we know about COVID-19 is most people, the incubation period and the presentation of symptoms, as the Director of Public Health said yesterday, is between 5 to 6 days. So we would have started seeing people presenting with symptoms from the community by the point we'd actually tested positive for the other case.
Let's clear up this thing about sending it over and there's a 5-day wait to find out which strain it is. Dr. Rachel Glover appears to be saying that if you used her, she could turn it around and give it to you back the same day. Is that acceptably?
No, we have the same procedure that we've always had, which is we use the labs in Liverpool. Yeah. The point is, actually knowing which variant it is isn't actually urgent. Now, the reason being... I
don't get that either.
Well, I'll explain it.
Yeah.
The reason being that the measures we've put in place are in response to the new variant. So we've already put in place the measures we would if the new variant was identified on the island. So the suspension of the exercise for 1 hour, people having to isolate for 21 days if they don't take the day 1 and day 13 testing, the day 1 and 13 testing itself. So nothing would change at this moment, even if it comes back and says it is the new variant, because we've already put the measures in place to secure the island based on an assumption that the cases we are getting are the new variant.
Okay, and at time recording, which is Monday, just after 9, how's it looking? I mean, when do we get the next update? When will you find out everything's negative or positive?
Yeah, so we've had some more test results back.
Yeah.
They have proved negative as well. There will be further test results that will slowly filter through, because obviously it depends upon the lab processing and when the results come through.
And people get swamped by 111. I mean, people say they can't get through, they don't know what's going on.
111 has obviously had a high volume of calls. In fact, after we did announce and put the press release out, I think it was 1,105 calls that went through 111 in total. People need to be patient, because the call handlers are trying to get through them as quickly as possible, but people are being offered surveillance tests if they require them, and if it's felt necessary, but all of the surveillance testing so far has been negative.
And that restaurant that said they rang to get advice and they were not clear of what they should do about staying open or shut. Have you dealt with that and put more procedures in place?
My understanding is the advice was fairly clear, right. In the fact that but my understanding is that what was said and what was asked was as a business, should we stay open? Yeah. 111 can't advise businesses what to do. Mm-hmm. From a public health point of view, there was no reason to shut or take any measures, and I believe that was made clear, but it's not for 111 to make the ultimate decision for businesses. Businesses have to do what they believe is correct on a risk-based approach.
Are we now in a position we can relax again, or vigilance to be kept up?
I think vigilance should always be kept up. I've made that absolutely clear from the very beginning.
This particular scare, is this one over now? Do you think it hasn't been seen? We dodged the bullet.
Well, I've got to keep my cautious nature, Paul. Yeah. COVID-19 can incubate for up to 14 days, so I don't think we can safely say that. If we get past the 14-day mark and nothing has been identified, then that tends to suggest that there isn't any form of spread.
Just trying to get the connection between dodging the bullet and today. What did the Chief call this? A silver bullet?
The speeding silver bullet.
Who wrote that for his script?
That's the Chief Minister's own phrase. Okay. And I think it's a very good phrase to use, because this could be the silver bullet for COVID-19. But let's get things rolled out in a medically professional way, and it is the light potentially at the end of the tunnel.